Hey there, welcome to my channel, Health Prosper. Today we're going to talk about something that might be all too familiar to many of you. Have you ever had that uncomfortable feeling in your stomach after eating? You know, that pain, bloating, or just an overall yucky sensation that makes you regret that last bite? Well, you're not alone. Stomach pain after eating is a common issue, especially among seniors. It can range from a mild annoyance to a real disruptor of your daily life. Let me share a story with you. I remember Mrs. Thompson, a 65-year-old patient of mine. She loved going out to eat with her friends, but every time she did, she would end up in discomfort. She would come home, lie down, and spend the rest of the evening in pain. It was really affecting her quality of life. She was missing out on social events because she was so afraid of the pain that would follow a meal. This isn't just a physical problem, it's an emotional one too. And that's why I'm so passionate about sharing this information with you today. In this video, we're going to dive deep into what causes stomach pain after eating, how to recognize the different types of pain, and most importantly, what you can do about it. So whether you're someone who experiences this pain occasionally or it's a daily struggle, stick around. By the end of this video, you'll have the knowledge to take control of your digestive health and get back to enjoying your meals without worry. What is stomach pain after eating? Before we jump into the causes and solutions, let's first understand what exactly stomach pain after eating is. Your stomach is like a hardworking factory. It's where the process of digestion begins. When you eat, your stomach churns the food, mixing it with digestive juices to break it down into smaller pieces. But sometimes this well-oiled machine can run into problems. Stomach pain after eating can feel different for everyone. It could be a sharp, stabbing pain, a dull ache, a burning sensation, or even a feeling of fullness or bloating. This pain can be in the upper abdomen, which is where your stomach is located, but it can also radiate to other areas like the chest, back, or sides. The pain might start right after you finish eating, or it could take a few hours to kick in. For some people, it's a mild discomfort that goes away on its own, while for others, it can be severe enough to interfere with their daily activities. And it's not just the pain itself. It can also be accompanied by other symptoms like nausea, vomiting, diarrhea, or constipation. Now, it's important to note that stomach pain after eating isn't always a cause for major concern, but it's also not something you should ignore. Understanding what's going on in your body is the first step to finding relief. Common causes of stomach pain after eating in seniors. 1. Gastroesophageal reflux disease. One of the most common causes of stomach pain after eating, especially in seniors, is gastroesophageal reflux disease, or GERD. You've probably heard of heartburn, right? Well, GERD is a more chronic form of heartburn. When you have GERD, the valve between your esophagus and your stomach, called the lower esophageal sphincter, LES, doesn't work properly. It allows stomach acid to flow back up into your esophagus, causing that burning pain in your chest and throat, which is often worse after eating. I had a patient, Mr. Johnson, who was 70 years old. He would often wake up in the middle of the night with a burning sensation in his chest. He thought it was just indigestion at first, but it kept happening, especially after big meals. When we did some tests, we found out he had GERD. Foods that are high in fat, like fried chicken or fatty steaks, can relax the LES and make GERD symptoms worse. Also, eating large meals or lying down right after eating can contribute to the problem. 2. Peptic ulcers. Peptic ulcers are another possible culprit. These are open sores that develop on the lining of your stomach or the upper part of your small intestine. They can be caused by a bacterium called Helicobacter pylori, H. pylori, which many people carry in their digestive tract. Stress and certain medications, like non-steroidal anti-inflammatory drugs, NSAIDs, can also increase the risk of developing ulcers. Mrs. Green, a 62-year-old patient started experiencing a gnawing pain in her upper abdomen after eating. It would come and go, but it was getting more frequent. After some tests, we found that she had a peptic ulcer. Eating acidic foods like citrus fruits or tomatoes could irritate the ulcer and make the pain worse. But the good news is that with the right treatment, including antibiotics to get rid of H. pylori if it's present, and medications to reduce stomach acid, ulcers can heal. 3. Gallstones. Gallstones are small, hard deposits that form in your gallbladder. Your gallbladder is a small organ that stores bile, which helps your body digest fat. When you eat a fatty meal, your gallbladder contracts to release bile into your small intestine. But if you have gallstones, this process can be disrupted. The stones can block the ducts that carry bile, causing pain in the upper right abdomen, which can sometimes radiate to the back or shoulder. Mr. Brown, a 75-year-old, came to see me complaining of severe pain after eating a rich fatty meal. He said the pain was so bad that it made him double over. After some imaging tests, we found that he had gallstones. For him, avoiding fatty foods like butter, cream, and fried foods helped reduce the frequency and severity of his pain. In some cases, if the gallstones cause frequent problems, surgery to remove the gallbladder might be necessary. 4. Irritable bowel syndrome, IBS. Irritable bowel syndrome, or IBS, is a common disorder that affects the large intestine. It can cause a range of symptoms, including abdominal pain, bloating, diarrhea, and constipation. The exact cause of IBS is unknown, but factors like stress, certain foods, and changes in the gut microbiome can trigger symptoms. I saw a patient, Mrs. White, who was 55 years old. She would get stomach pain, bloating, and diarrhea after eating foods like dairy products, wheat or high iron fiber foods. For her, keeping a food diary to identify trigger foods and managing stress through relaxation techniques like meditation helped a lot. There's no one size fits all treatment for IBS, but making dietary and lifestyle changes can significantly improve symptoms. 5. Lactose intolerance. As we age, our bodies may become less efficient at digesting lactose, a sugar found in milk and dairy products. Lactose intolerance occurs when your body doesn't produce enough of the enzyme lactase, which is needed to break down lactose. When you consume dairy products, if you're lactose intolerant, the undigested lactose can cause stomach pain, bloating, gas, and diarrhea. Mr. Smith, a 68-year-old, noticed that every time he had a glass of milk or a scoop of ice cream, he would feel terrible. His stomach would start hurting, and he would get really gassy. Once we diagnosed him with lactose intolerance, he started choosing lactose-free dairy products or alternative milk like almond milk or soy milk. This simple change made a big difference in his digestive comfort. Recognizing different types of stomach pain. It's important to be able to recognize the different types of stomach pain because it can give you clues about what might be causing it. 1. Burning pain. A burning pain in the upper abdomen, especially after eating, is often a sign of GERD or acid reflux. It can feel like a hot, searing sensation that starts in your chest and may move up into your throat. This pain is usually worse when you lie down or bend over. If you experience this type of pain, it's a good idea to avoid foods that can trigger acid reflux, like spicy foods, caffeine, and chocolate. 2. Gnawing or dull pain. A gnawing or dull pain in the upper abdomen could be a sign of a peptic ulcer. This pain often comes and goes and may be relieved by eating or taking antacids, but it can also get worse after eating certain foods. If you have this type of pain, it's important to see a doctor for proper diagnosis and treatment. 3. Sharp stabbing pain. A sharp stabbing pain in the upper right abdomen could be a sign of gallstones. This pain can be sudden and intense and may be accompanied by nausea and vomiting. If you experience this type of pain, especially after eating a fatty meal, it's important to seek medical attention right away. Cramping pain. Cramping pain in the lower abdomen is often associated with IBS. This pain can be accompanied by bloating, gas, diarrhea, or constipation. Keeping a food diary and avoiding trigger foods can help manage this type of pain. 5. Generalized pain and bloating. If you feel a general sense of pain and bloating all over your abdomen, it could be due to a variety of factors, including lactose intolerance, food allergies, or overeating. Pay attention to what you eat and how you feel after eating to try and identify the cause. What seniors can do to relieve stomach pain. After eating, 1. Dietary changes. One of the most important things you can do to relieve stomach pain after eating is to make dietary changes. If you have GERD, try to avoid foods that can trigger acid reflux, like fatty foods, spicy foods, caffeine, and chocolate. Eating smaller, more frequent meals instead of large meals can also help. For example, instead of having 3 big meals a day, you could have 5 or 6 smaller meals. If you have a peptic ulcer, avoid acidic foods like citrus fruits, tomatoes, and vinegar. Also, cut down on caffeine and alcohol, as these can irritate the ulcer. Eating foods that are high in fiber, like whole grains, fruits, and vegetables, can help protect the lining of your stomach. For gallstones, it's best to avoid fatty foods. Choose lean proteins like chicken, fish, and beans, and eat plenty of fruits and vegetables. If you have IBS, keep a food diary to identify trigger foods. Some common trigger foods for IBS are dairy products, wheat, and high fiber foods. Once you know what your trigger foods are, you can avoid them or eat them in moderation. If you're lactose intolerant, switch to lactose-free dairy products or alternative milk like almond milk, soy milk, or coconut milk. You can also try taking lactase supplements before eating dairy products. 2. Lifestyle changes. In addition to dietary changes, making lifestyle changes can also help relieve stomach pain after eating. If you have GERD, try to avoid lying down right after eating. Wait at least 2 to 3 hours after eating before lying down. Elevating the head of your bed by a few inches can also help prevent stomach acid from flowing back up into your esophagus. Managing stress is also important, especially if you have IBS. Stress can trigger or worsen IBS symptoms. Try relaxation techniques like meditation, deep breathing exercises, or yoga. Taking a walk after dinner can also help with digestion and reduce bloating. 3. Over-the-counter and prescription medications. There are also over-the-counter and prescription medications that can help relieve stomach pain after eating. If you have acid reflux or GERD, antacids can provide quick relief. These medications neutralize stomach acid, but if your symptoms are severe or persistent, you may need to take prescription medications like proton pump inhibitors, PPIs, or H2 blockers, which reduce the production of stomach acid. If you have a peptic ulcer, your doctor may prescribe antibiotics to get rid of H. pylori if it's present, along with medications to reduce stomach acid. For IBS, there are medications that can help with diarrhea or constipation, depending on your symptoms. But it's important to talk to your doctor before taking any medications, especially if you're already taking other medications for other health conditions. When to see a doctor. While many cases of stomach pain after eating can be managed with dietary and lifestyle changes, there are times when you should see a doctor. If your stomach pain is severe, doesn't go away with over-the-counter medications, or is accompanied by other symptoms like vomiting blood, black or tarry stools, or difficulty breathing, seek medical attention right away. Also, if you've made dietary and lifestyle changes, but your symptoms persist, it's important to see a doctor. They can do tests like endoscopy, which allows them to look inside your esophagus, stomach, and small intestine, or imaging tests like an ultrasound or CT scan to find out what's causing your pain. Don't be afraid to talk to your doctor about your symptoms. Remember, they're there to help you, and early diagnosis and treatment can often prevent more serious problems from developing. Conclusion. Friends, I know that dealing with stomach pain after eating can be really frustrating and uncomfortable. But the good news is that in most cases, there are things you can do to find relief. By understanding the causes, recognizing the different types of pain, and making the right dietary and lifestyle changes, you can take control of your digestive health. I've seen so many of my patients go from suffering after every meal to being able to enjoy their food again. It's all about making those small but important changes. Whether it's cutting out a trigger food, taking a short walk after dinner, or trying a new relaxation technique, every little bit helps. If you found this video helpful, please give it a like, leave a comment sharing your experiences or questions, and subscribe to our channel, Health Prosper. We're here to support you on your journey to better health. Remember, your digestive health is an important part of your overall well-being. Don't let stomach pain after eating keep you from living your best life. Take action today, and here's to a future of pain-free meals.